Dr. Ronald Schweitzer, Clinical Research Report on the Effects of a Low-Carb Diet on Type 2 Diabetes, Part 1, from the Low Carb Down Under Conference, Summer 2021.
So good morning, and thank you, Rod, very much for inviting me. It's fantastic to be here and present. My daughter-in-law was featured in this article around Australia with the launch of Defeat Diabetes. She's had type 2 diabetes for a few years, and she's gone low carb, and as it says, she's been able to decrease her HbA1c from the 8s down to 5.9 and lost 12 kilograms.
So, Dr. Schweitzer's clinical research, he formed two groups of type 2 diabetic patients. One group, those willing to try a low-carb approach. Group 2, those choosing to stay with their current diet.
I recruited patients the following way. I looked at patients who had been seeing me just as my regular patients who had type 2 diabetes, and I sort of tried to convince them to go low carb, and I reckon about 2/3 of those agreed. And then I would also get some patients from other GPs in the practice who I would see just because they would see me intermittently, and maybe 1/3 of them would agree. And this was a little blurb that I would say to them. Oops is right. The low-fat, high-carb diet we've tried for the last 20 years has caused your diabetes, blood pressure and heart disease. Oops. Out there, and I explain that it's not accepted by the majority of health professionals, that we're in a minority, 5 to 10% I would guess, but I've certainly found it to work better than anything else, and I get an idea of their interest. And then I explain the basic physiology of glucose metabolism, which probably most of you all are very familiar with. Complex carbs, I mean, we all were taught that complex carbs are the good carbs, and that, because they get broken down a lot slower, but they get broken down to glucose, and it says this on the diabetes website. This is not a secret. The diabetes website also says that this has the biggest impact on your sugar levels. That's not a secret. And then they tell you to go and eat carbs.
He explained that on the diabetes website, it says that complex carbs get broken down into glucose. And it says, this has the greatest impact on your blood sugar levels. However, the site also recommends a diet high in carbs.
And then I use some of the infographics by David Unwin, which are just fantastic. And, I show them this slide and explain that one bowl of basmati rice is 10 spoons of sugar that sort of gets broken down to, and that's roughly the same as a can of Coke. And you have 2 or 3 eggs, and that's about 0 spoons of sugar. How amazing is that?
He shows Dr. David Unwin's chart. For example, 1 serving of rice is equal to 10 teaspoons of table sugar. 1 serving of eggs has 0 sugar.
And I use Peter's wonderful colour chart. Thank you, Peter. And I give those out and give big ticks on the left side and a question mark in the middle and big crosses on the right-hand side.
And he shares Dr. Peter Bruckner's chart of all the types of food. Green means great to eat. Yellow means use caution. Red, avoid.
And then I give them some resources. So most of the times I would get an email address and I would send them some links, lots of links. I mean, there's a bucket load of links out there. And in the last few months, I've been also referring them to the Defeat Diabetes app. And then I put it into practice. I recommend low-carb changes. A lot of them have had muesli and cereal because we're all, been told how great they are. And, and I say, well, maybe try some eggs and bacon or smoked salmon or whatever you like. I adjust medications according to I won't go through that, but make sure that it's all done safely. Tell them it's now time to have a little bit of salt if you're going low carb. And I generally review them in 1 to 2 weeks, check what they're eating, how they're going, see if they've lost some weight, check their satiety, their hunger. A lot of them ask me what I eat, and I'm quite happy to share it. And I've got some photos on my phone, and so I'll show them what I'm eating because it's good to get visual. So I say nothing for breakfast. Make sure you keep fluids. You've got to keep the kidneys working. And then for lunch, that's when I have a decent amount to eat, and 2 or 3 egg omelette there with some leftover cauliflower from the night before and some leftover chicken. So whatever you sort of have, there's nothing magical about this, just standard sort of stuff. And dinner, protein sort of based dinner, so I might have some chicken livers or some salmon, fantastic, just delicious, and some lamb, some steak, all good stuff, all real food. And then for snacks, I'm still a bit of a chocoholic, so I still like my dark chocolate, and then some other things, nuts and cheese.
Dr. Schweitzer says, my daughter-in-law was featured in an Australian news article in the Herald Sun this year. Type 2 diabetes reversed. And there's a new app called Defeat Diabetes. His daughter-in-law was 8.1 hemoglobin A1C. After changing her diet to low carb, it's now 5.9, and she has lost 12 kilograms. So, Dr. Schweitzer's clinical research, he formed 2 groups of type 2 diabetic patients. One group, those willing to try a low-carb approach. Group 2, those choosing to stay with their current diet. He explained that on the diabetes website, it says that complex carbs get broken down into glucose. And it says, this has the greatest impact on your blood sugar levels. However, the site also recommends a diet high in carbs. He shows Dr. David Unwin's chart. For example, 1 serving of rice is equal to 10 teaspoons of table sugar. 1 serving of eggs has 0 sugar. And he shares Dr. Peter Bruckner's chart of all the types of food. Green means great to eat. Yellow means use caution. Red, avoid. He gives these references and resources for his patients to use. He reminds them about the Defeat Diabetes app. For those on the low-carb diet, he meets with them. He recommends low-carb changes to their diet. For example, for breakfast, switching from eating grains to eggs and bacon or smoked salmon. He adjusts their medications as needed. He recommends that they add more salt and then does a 1 to 2 week follow-up review. Asks them about what foods they're eating, about their weight, about their satiety. And then he shares with them what he eats.